Welcome to the Seasoned Sonographer, the podcast where experience meets education in the world of OBGYN ultrasound. My name is Lynn Flamm, and I'll be your host. I'm a registered diagnostic medical sonographer with over 32 years of experience, most of that time in OBGYN ultrasound. Through this podcast, I'm here to share insights, tips, and case studies to help you sharpen your skills and optimize your scans. Whether you're just starting out or you're a seasoned pro, this is the place to grow your knowledge and confidence. Let's dive into today's episode. Welcome back to the Seasoned Sonographer. I'm your host, Lynn Flamm, registered diagnostic medical sonographer, and today I'm joined by Dr. Jocelyn Peters, a compassionate OBGYN from Houston, Texas. Her practice has something truly special. Her entire office speaks Spanish to ensure every patient feels heard and understood. We'll talk about the cultural and regional differences that shape women's health care, how communication can bridge gaps in understanding, and the role ultrasound plays in patient trust and education. This is a conversation about more than images. It's about connection. Welcome to the Seasoned Sonographer, Dr. Peters.
Thank you.
Can you give us a little bit a background on your journey into OBGYN and what drew you to Houston?
Yeah, my journey, it's been a long journey. I'm from Caracas, Venezuela, so I was born and raised, and I did medical school in Venezuela. But everything started before I started medical school. I went as an exchange student and lived with an American family in Nebraska. And so I was able to learn English. And I realized all the amazing opportunities that the US had. And I decided that once I finished medical school, I would want to come over and do residency. And so after I graduated, that's what I did. And yeah, it was very painful to study everything and take all these exams to become a doctor here in the US in a different language. But I did it and then applied to residency. And I got into Detroit, amazing program. So I learned tons from everybody there. It was an excellent experience. And then I had to, after I graduated, then I worked in an underserved area a little bit in Laredo before I met you in Carbondale. And that's when I decided that I think Texas was the place to be. And the reason for that is because of my Hispanic background. I realized I had a good interaction with all the patients, especially the ones who were born in Mexico or in any other Hispanic country. And so that's what kind of drew me to Houston. Also, there was a lot of Venezuelan community in Houston. And so I said, okay, maybe I could see myself opening up my own practice and whatnot. And so that was way before I met you, when I kind of scouted the area. And yeah, I said, I think this would be a good opportunity for me here.
That's an awesome story. What inspired you to create this fully bilingual practice where mostly everyone speaks Spanish? So you started this private practice in Houston, and I came to visit you, and it's so beautiful. Your office is beautiful, and the town is wonderful. All of your staff speaks Spanish, and you said your first sonographer did speak Spanish.
Correct.
But this new sonographer does not. Did you intentionally create this fully bilingual practice, or did it just kind of happen?
So basically, I realized when I lived in my short-term living here in Texas that there was a huge need of bilingual staff, bilingual offices. So most of the doctors, they are trained, they don't speak Spanish. And so for OBGYN, I think it's key to kind of speak the same language, because I always notice patients will bring their granddaughter, their daughter, or grandson or son. And so sometimes it's a bit uncomfortable to talk about these personal stuff, in front of your daughter or everybody, to translate. And so that's when I started thinking, okay, so this is a good opportunity for me because I'm bilingual to open up my own practice. And then definitely I want to have the whole staff bilingual so the patients can feel comfortable and they don't have to bring their family member for translation purposes. So yeah, that's basically what I did.
So, how do your patients respond when they realize that your whole office can communicate with them in their native language? I bet it's just so comforting. I mean, how do they respond?
Oh, the response was amazing, and the word of mouth has been great. I get patients. Oh, so and so refer me. My aunt, my cousin, this, and my friend. There are your patients, and so I came here. They love it. They love it, and yes, it is comforting because they feel a little bit connected, especially like my Venezuelan friends, because I speak the Venezuelan slangs and stuff like that, and so they start laughing with me. Oh my gosh, it's been a while since I heard this word. And so yes, and I have patients that come from Dallas. They come from an hour and a half away. Dallas is 3 hours and a half away just to see me, just because I am speak Spanish. I'm a female OBGYN, and the whole staff also speaks Spanish. So they feel very comfortable.
That's wonderful. So, what are the some of the most common challenges you've seen then among the Hispanic and Spanish speaking patients when accessing women's health services? Just
So
is it the language barrier mainly?
that's a great question, because once you remove the language barrier, which is what we did, and so the most common challenge that we find is all about the insurance. There are things that they don't understand. They don't understand copays, why they have to come on a visit and pay a copay, or they don't understand, for instance, why in a prenatal care only two ultrasounds are covered, which is the anatomy scan and the growth, or hey, today is your visit for this complaint. Later on, you have to come back for the ultrasound. They don't understand why they cannot have a bunch of things all done at the same time. A lot of, because of insurance here, it only pays for one particular problem at a time. Otherwise, you're going to end up with a bill. And they always say, oh, but in Venezuela, my doctor will do ultrasound, pap, this, and that, all at the same time. And so, yeah, it's about like, remember, yeah, in Venezuela, you would pay and in Mexico too, and in every other country, like in South America, you pay a fee, and that fee, it probably is included the ultrasound and all of that. Is different than with the insurances here. And so
Right.
that's our main challenge, for them to try to understand that the system here, based upon the insurances, is completely different. Mhm.
Gotcha. And how does this affect the patient compliance in their prenatal or gynecologic visits?
After we explain to them that, for instance, if they would like an extra ultrasound, if they want to pay it out of pocket, they're welcome to do so. But for prenatal care purposes, it would be covered just the anatomy scan and the growth ultrasound. Most of them, then they're fine. And whomever wants to pay the extra fee for an extra ultrasound, then they also will do so. So, I mean, we give them the option, and some of them they're fine, and some of them will be like, no, I'll just stick, and I don't want to pay extra, and so that's when they understand, and then they just follow the guidelines or whatever the insurance wants.
Are
Mhm.
there specific cultural beliefs or expectations that you think providers should be more aware of when caring for this type of population?
Well, yes, it's gonna sound weird, but Hispanic patients like to be touched and examined, and yes. And I, right now also I'm a preceptor of medical students, and I tell them one little example. Guidelines said that you should not do a pelvic exam and a women's exam unless, the patient complains of pain or is there a particular complaint. But then I tell my students, if you tell the patient, okay, I'll do your pap and that's it, any of my Hispanic patients immediately going to think, oh, the doctor is not good. She did not examine me. She did not touch me. She didn't do anything that she needed to do. So in those little cases, I basically don't follow the guidelines, and I'll do their pelvic exam. Obviously, I listen to them a little more. They love to talk. And so, because in that way, they feel like they got the similar care as if it were in their own countries. The same with Mexican patients, the same with Central America or South American patients. And so just a little example, but yeah, they like to be examined. And so sometimes they complain and they say, oh, the American doctors, they don't put the stethoscope on me. They don't touch, they don't check me. And I'm like, yeah, it's a different style. Oh, okay. Well, I'm glad that you're here and you understand me. And so yes, I have to be, extra
Yeah.
with them.
Yeah.
Yeah.
So how does OBGYN care in Houston differ from other regions you've worked in or observed? And even, we worked together in Southern Illinois. So, and I know Southern Illinois is rural area and Houston is a large metropolitan. How does that care in Houston differ from other regions?
I don't know in terms of Houston, but I will tell you, particular to my patient population. My patient population would be 60% Hispanic and then 40% American. But the comparison is that with my Hispanic patients, yeah, I have to, do extra examination. I cannot tell them, hey, if your puppy's normal, I'll see you in 5 years. What? No, 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 no. That will not fly with them. Even though they don't understand that we have a different technology, and basically it will be okay. And so, whereas up north, even in Southern Illinois, I would tell the patients, hey, your pup is looking good. We can go ahead and repeat it between 3 to 5 years. And patients are fine with it. Okay, all right, see you, no problem. Okay. Or patients are fine if I explain to them, okay, well, for the guidelines, we don't need to do this, and this is what we're gonna do. And then they're fine with it. Here they expect, to be examined, to get blood work, and to do a lot more, because that's the way in our countries.
Mm-hmm. They want the whole physical exam.
The whole
Whole deal.
shebang. The whole
Whole
shebang.
deal.
Yes.
So going back to ultrasound, what role does ultrasound play in helping you connect with your patients? And how do you explain like complex findings, any abnormalities with OB or like thickened endometrium for postmenopausal patients?
Ultrasound, the role of ultrasound in terms of OBGYN is vital. It's super important. In terms of prenatal care, basically, one, it helps me to detect what is abnormal and kind of like do a triage. And then from there, we kind of, I refer those patients to MFM, so they can repeat the ultrasound and confirm what we have found. And the role has been vital. Just a few weeks ago, I got a letter from a patient of mine that we discovered a cardiac abnormality. We sent her to MFM. MFM, in fact, confirmed that she had tetralogy of Fallot. She was then referred to, because here in my town, the hospital is good, but we don't have all that, all the subspecialties. So she was referred to downtown Houston, and she was cared there, and she delivered. She got complicated with other stuff like preeclampsia and whatnot, but every subspecialty, everything that she needed, it was there. And it was all because we did an anatomy ultrasound at 18 weeks, and we were able to speed that process up.
Good, and give the best, patient and fetal outcome.
Exactly. And now the baby is doing good, and it is being referred to a pediatric cardiology for further evaluation. So I'm glad that basically we have that tool, that the ultrasound, and with the 3D and all of that, that helps us to catch these patients. And in terms of GYN, well, it's the same thing, especially like, with endometrial thickening and whatnot. We could say, okay, there's polyps, or this looks cystic. It could be maybe hyperplasia. And that it's really helpful, because with that information, then I tell the patient, you need a hysteroscopy with endometrial biopsy. And that's how I'm able to go ahead and catch endometrial hyperplasia and or cancer. So, and polyps too, and all of that. So it's vital. Without ultrasound, I don't know what would I do.
Ultrasound makes a big impact on how you care for patients, that's for sure. So do
Yes.
you find that showing patients images in real time or going through their images with them changes how they perceive their care and how they receive their diagnosis?
Yes, definitely. In fact, sometimes the sonographer calls me in the room and she mentions me, hey, I'm concerned about this. And so I explain in real while we are doing the ultrasound and all of that, what is going on and what is the concern and all of that. And we can make a plan like right then and then. So that's key.
What advice would you give to sonographers or providers working with diverse patient populations?
Well, I guess that yeah, my biggest advice is, be patient because some patients, that you might see, they just arrived to the country, 1 year, been in the country for 2 years, and they really quite not get and understand the system, the healthcare system. So my biggest advice is be patient with them. At some point, they'll get it. And the other thing is, I know that not everybody can be bilingual, trilingual, but the other day I heard one of my students told me ChatGPT has this amazing translating opportunity. And so a lot of ER doctors who they don't speak Spanish use ChatGPT. And so I told my sonographer the other day, if you encounter any difficulties, please use ChatGPT to kind of translate and communicate. So in that way, it's easier for her and for the patient too.
That kind of answers my next question is how do you prepare your staff to communicate and connect effectively across those cultural lines is basically to use your resources, use chat gpt for translation, use you when you can step into the ultrasound
Correct.
room and translate the findings, and even telephone interpreters. But there's
Correct.
a lot of ways to communicate and connect with these patients. What is your biggest takeaway about the intersection of language, compassion, and women's health? What's the biggest takeaway?
Let me think about that. I think the biggest takeaway. I am very happy that I started this endeavor and this practice, and I'm really happy that I chose Houston because a lot of patients will come to me and say, "Oh my gosh, I'm so happy I found you. You have no idea. I've been looking for an OBGYN that I could talk to that OBGYN for years, for years. They've been in the country for many years and they could have not find somebody that was comfortable. And so that must be hard. So I guess my biggest takeaway is that I am glad that I made the office bilingual, that I am glad that I am bilingual, and that I am able to provide all these services to the patients that actually need it because they have not been able to communicate.
How do
Yeah.
you envision the future of this culturally inclusive care in OBGYN? What do you think the future looks like?
It looks like everybody's going to have their chat GPT translator, and which is great. Sometimes I have had patients, Brazilian patients. I have a quite a bit of Brazilians. And
Mhm.
so I'm like, oh Lord, I speak. And so I said, Portuñol. So it's like a little mixture of Portuguese and Espanol. And so we can kind of go at it, a little bit of English. But sometimes I have to just bring my phone and, try with Google Translator and start doing it. And we understand really well, and she understands, and the conversation flows. So that's the most important thing, and they understand, and they leave happy because they understood all the information.
Mhm.
So yeah, what I envision is everybody in their phone will have a translator app, and that's easy to access and quickly start talking to the patient, and immediately you can start solving their problems.
And with AI, I mean, we can envision a lot of wonderful things happening in the future for OBGYN and women's healthcare. Ultrasound machines now have AI on them,
Mhm.
and this may be built-in translators
Correct.
someday. We may be doing the ultrasounds that assist with obtaining the images and taking the shots of the appropriate images, and it translates while we work. So
Yes. Yeah.
that's a lot with AI is going to happen. It's going to happen fast.
And it's going to happen soon, yes. And yeah, and on the other hand, I'm also playing my part. I'm raising my kids bilingual. I'm trying to, of course, be culturally inclusive with all the Hispanic culture. Last Thanksgiving, we traveled to Argentina, and everybody there was impressed that the gringos were speaking Spanish.
Oh my
So,
goodness.
yes.
I bet that was a great experience for your boys.
Oh, yes. Well, my littlest one does not remember, but my 5-year-old, he remembers, and he had a great time. Yes, yes.
Yeah.
And they are in a bilingual program right now, full immersion, English and Spanish. So yeah, yeah. Not easy, but we're trying to make it work.
Thank you to your contribution in women's health, and you're a great OBGYN physician that I have worked with and enjoyed my time with you. So best wishes in your practice, and thank you so much for coming on to the Seasoned Sonographer.
Of course, it was a pleasure to be with you, Lynn.
Thank you so much for joining me for this episode of the Seasoned Sonographer. If you're interested in improving your OBGYN ultrasound skills and learning more about the field, make sure to subscribe to the Seasoned Sonographer on Apple Podcasts, Spotify, and YouTube. You don't want to miss any of the upcoming episodes. You can also connect with me on Facebook and Instagram at Sonotechniques Academy. Explore more educational resources on the Sonotechniques Academy app, or reach out via email, lynn@sonotechniquesacademy.com. I'd love to hear from you. If you have questions or topics you'd like for me to cover, feel free to reach out. This podcast is for you, and I want to make sure I'm covering the topics that matter most to you and to the ultrasound community. Until next time, keep striving for excellence in your scans, and I'll see you in the next episode of The Seasoned Sonographer.